you.
Hey, Colleen, I can make you the host too. I don't know who's gonna host it. So whenever you want.
Sounds good.
Okay. Hey,
I
Chris.
didn't know if you were saying something at the beginning and you wanted me to step in later, so I figured I'll let you tell me. I was just out there trying to get my presentation ready to go if I am sharing it before you guys do anything.
Oh, no
So,
problem. We got about 20 people coming on. So I'm here at the
okay.
office. We got people here at the office watching it too.
Okay.
So,
Do you
yep,
want me to start sharing then?
absolutely. Yep.
Okay. We'll see how this goes. Okay. Can you see my screen?
Yes.
Yes.
Yay. Technology is my friend today.
Yeah.
Let me know whenever everybody's here and you want me to get started.
I'm saying maybe in like 3 minutes.
Okay. That sounds good to me.
Right.
Okay, it's 10:33. Do you want me to get going?
Yes.
Okay. Well, hello and welcome everybody. I am Colleen Heilman. I am a regional agency manager for WellCare, and I only focus on Pennsylvania. And I do have a cohort in crime. Her name is Carrie Livengood, However, she is en route to another event, so she may be on, but it's going to be tough for her to drive and present. So I'm going to do the majority of it. So we're going to go over Centene overview. It's going to be really quick because I'm sure you're familiar. But on this slide, the one thing I wanted you to take away from is that WellCare serves 1 in 15 individuals. And that is huge. That means we touch a lot of lives. So it's a company that Centene name is not known, but we do have a huge footprint. With that being said, we added Iowa. It's a new state that we're going to be in. I'm not sure if anybody does sales across the United States, but you can see all the states that we're in already. And that's for the MAPD footprint. For DSNP, we're in a lot of those states. And for PDP, we're in all of the states. Excuse me. And this is for your knowledge to know that Pennsylvania, you will see it in magenta. So we are a VBID and SSBCI state. So we do offer those benefits in Pennsylvania. Now, 2025, we don't have the Liberty Plan. That is put in there as a general information, but we do have the Access Plan. That is for LIS individuals. And we are so thankful that this year coming up, 2025, they filled a hole that we've had ever since we came to Pennsylvania. And that's for the partial, not the full duals. So we've had a full dual plan from the very beginning, but the reserve plan is now going to complete our products. And we are going to have one for LIS, that's the Access, one for partial duals, and that's going to be the reserve. And then we have our full dual DSNP plans. So if you're up on SlimB, Quimby, SlimB Plus, Quimby Plus, it's all listed there, but we're going to go over it a little bit more too. Okay. I am Colleen Heilman, top right. Carrie Livengood, my cohort in crime, is top left. Then you may or may not know our manager, Nicole Marazzo. She's the bottom right. And then the sales director over the Northeast region is Christopher Myers. With Pennsylvania, I wanted to let you know we are in 65 of 67 counties. So we're in all of them except for Northumberland and Columbia. And that's because we cannot get the hospital system there to get on board with us. We do have talks with them. So there's hope in the future that that will then be filled in and will be in all of the counties. In case you're keeping track of the different types of plans, we are actually a HIDE plan. So highly integrated DSNP plans are what we offer. Now, we're going to go over the different verbiage for what WellCare calls the different areas. So we do have, again, 65 to 67. They call the Philadelphia area as Philadelphia subregion. I'm just going to call it the Philadelphia 5-county area. Pittsburgh, they call it the Pittsburgh subregion, and that's just the group of counties right around Pittsburgh. And I like to say, I think somebody has been watching too much Outlander because they call Central PA outstate. So obviously somebody from Pennsylvania did not name that because I've never called it outstate. And if you tell somebody, oh, I have to, and they won't even know what you're talking about. So going forward, I'm going to refer to the outstate area as Central PA, like the rest of us probably would do. So we're going to go over the 2025 products. And the one thing, if you've been selling our plans, we have a WellCare no premium plan right now. It is getting a name change for 2025. It is going to be WellCare Simple. and it is just a name change. The plan is basically the same. Yes, it's probably been tweaked a little bit, but it's not like the whole plan got revamped. It's just a name change. So I'm not going to focus on all of the plans that we offer, but I would be remiss if I didn't tell you we have them. We're going to go over more in depth on our focus plans, but I wanted to let you know we do have WellCare give back plans for the Part B premium give back. We do have the simple and the simple open. And with WellCare, anytime you see the word open, that's going to be a PPO. Not quite sure why they didn't just put PPO there, but they didn't. But that way it's not tricky. Anytime you see open, that just means it's a PPO. The WellCare Assist, that's the plan for LIS. And we do have a veteran plan. It's MA only, and that would be the WellCare Patriot Give Back. So we do have that as well. Then we have the simple, and you'll see that there's going to be two different ones because they're regional. And we have the WellCare Give Back Open and the Patriot Open that we've gone over, and you'll see where they state whether they're HMOs or PPOs, but the open is pretty much the definition of where we have the PPOs. And then we go to our DSNPs, and we do have a WellCare Dual Access Open. That would be our PPO DSNP. I just want to caution you with that one, because if you can get them into one of our HMO plans, you're going to be doing them a service, because the PPO is a good plan. It's just sort of watered down on the benefits. So we do have the dual access, the DSNP, which is an HMO, and that is 002. That's the one that's going to be in Philadelphia and also in the Pittsburgh area. And then we have the 007. That's again an HMO dual. That one is going to be for Central PA. And then we have the brand new one, the dual reserve, and that's the one that's partial that we were talking about. And if you want me to, I can send the whole slide deck over to you so you can have that, because a lot of people want to know the MSP levels, and this lists it out for each of the plans. And that's really helpful if you know what they actually have as their level. So now we're going to go over the focus plans. These are the ones where we're really, really strong. They're our best sellers. And this year we have a couple advantages that we didn't have last year. So this is the Patriot Give Back HMO. This is the one that does not have prescription drug, but it is basically for the veterans. And you'll see off to the right all the counties that it covers. And I'm happy to say they actually increased the Part B premium give back. That's $100. There is no premium at all. And then there is no deductible. Now, with this plan, they're usually going to have some type of benefits, VA, Champus, something, TRICARE for Life. This will go along with their plan. They're not going to lose benefits. And the one thing nice about this, if they are a veteran, they get to choose what benefits they want to use off of which plan. If it's to their advantage because of, say, a copay, they can use the VA for the inpatient services, because you'll see our plan is $345 copay per day 1 through 5, where I believe the VA coverage is going to be a lot less expensive. So as you're presenting this, you want to make sure to remind them they can choose whatever portion of this plan they want to use. And if they want to just get a plan, use their current coverage, but they want that $100 in the give back, they can do that as well. We do have the PCP office visit 0, specialist is 30. Over the counter, they do get $65 per quarter, and that's for covered items. The fitness, they have the Silver and Fit with that. And with this dental, they do have the covered preventative services and $2,000 maximum for comprehensive dental services, including dentures. We give them some vision benefits. It's $200 on the eyewear, 500 per ear per year for the hearing. So that's actually going to be $1,000 benefit. And then labs go anywhere from 0 to 50, and the x-rays are $25. And again, remember, this one does not have the prescription with it. Okay, and then we are going on to the D-SNP. This is the one that is going to be both Philadelphia and Pittsburgh regions. So I'm a person that likes to come up with things so that I can easily remember, so I'm not caught off guard. So if you remember 002, it covers two major areas, Pittsburgh and Philly. And as we're going through the benefits, you're going to see that this year WellCare has made both D-SNPs, whether it's the 002 or the 007 for Central PA, almost match identically. The one area they don't is the WellCare spendables. You'll see that it says they get $192 every month. That's another way to remember 002 has 192 for that benefit. As a D-SNP, you know, most of it's 000. So the one thing I did forget to tell you about the WellCare spendables is that it does roll. Now, if you use Sunfire, because it was just pointed out in a meeting I got out of just minutes ago, it says that our WellCare spendables amount does not roll. That is incorrect. If you go the whole way to the bottom and you click on specifics and you go to our benefit, our summary of benefits, that actually says it does roll. Sunfire is a very good platform. However, you cannot trust it for our doctors, and you cannot trust it for things like that. Okay. So the medically necessary transportation, 60 one-way trips every year. We have the fitness included, the PERS, that's I've fallen and can't get back up, that's included. We have dental and comprehensive dental. We have no maximum. We do include 2 implants per year. Now, when you tell a client they have no maximum, you have to sort of do a caveat, but there are service maximums. So they could not go get their teeth cleaned every week, and they couldn't have 50 implants. So there are service maximums like that. But other than that, if they need to get fillings, root canals, crowns, caps, things like that, there is no dollar amount. Some of those do need to be pre-authorized, but other than that, there are only service maximums. We have the eyewear that's $600 allowance, and then $1,000 per ear per year for the hearing. Again, that's a $2,000 benefit, and most prescription drugs are going to be picked up entirely for them because they're full dual. Now, this is the 007. It's for Central PA. I am not going to bore you going through exactly the same thing. The only thing I want to bring to your attention here is the WellCare spendable amount is $193. So that's the only difference between the 002, 007. And again, the easiest way to remember is 007 is central, 002 is everywhere else. So you do want to make sure that you're enrolling the person in the right plan based on their counties, but that makes it a little bit easier because the benefits are the same except for that one spendables. Okay, we're going to go over the new product, which I am really excited about because we've been asking for this for years to fill in the holes. So we do have this dual reserve open. It is a PPO. It is for partials. There is that premium, and depending upon LIS, that could change. I do want to bring one thing to your attention, and this is why I am going to say, make sure that the doctors are in network, and especially the hospitals. If you see the inpatient hospital stay, it's $250 per day for days 1 through 5. But if you look at the out of network cost, it's 40% of the total cost for days 1 through 90. So no matter who you enroll in this plan, you want to make sure their hospital of choice is in network. You don't want them getting an outpatient surgery at a facility and incurring 40% of the cost. With that, I want to remind you all urgent and always paid out as inpatients. So it's just if they're going to have scheduled services. So the PCP office visit is $0 and it's $25 for the specialist, and they get $76 a month on their WellCare spendables. And our spendables can do the healthy food. They can use it for utilities, for rent. We have home improvement and safety items. We also have pay at the pump. So we have a lot of good things they can use this for. And then with this plan, they have 36 one-way trips every year. The fitness is included, PERS is included. With the dental, they do have the coverage for the preventative services and a $4,000 maximum for comprehensive. It includes the dentures, but this plan does not have implant coverage. Then we give them $300 for the vision, for the eyewear, $1,000 per ear per year, or a $2,000 benefit. And then the generics and the brands, those are basically paid out with the copays according to their LIS status. And supplemental benefits. This is why most of the clients get the plans. It's actually not for the medical, but we'll go over those. Now, the WellCare spendables we have on all our plans, the routine dental, vision, and hearing included on all plans. Then the non-emergency medical transportations we have on most of the plans. Fitness is on all, the PERS is on some, and the meal plans are the ones that they would get if they come out of a hospital or a rehab center. So they would get them sent to their house. That way they have that covered if they're still trying to get mobile, or they may not feel like cooking for themselves after just getting out of a facility. And TWIL is going to be on all plans, and it is something we're going to go over a little bit more in depth. It's more of a behavioral health added benefit. We have routine acupuncture, chiropractic, and podiatry on some of the plans. Now, this is the TWIL, and it is actually going to be for the members to download and sign on to their smartphone. It is to give them a backup plan if they're having trouble getting into a behavioral health provider. They have peer-to-peer support, self-guided behavioral health programs. It's something they might not want to go in person to see somebody. So this is an extra added benefit. That way they can still get some behavioral health help or backup. And this is just, again, download and sign on to a smartphone. I don't know if anybody currently has any enrollees in our plan, but this is a WellCare spendable card. This is the card we've had for a couple of years now. If you see the things in maroon, I'll call it, the dental, the vision, and the hearing. Currently for 2024, they can pull funds off of their spendable account if they want to pay for any of these items above and beyond what their benefit is, if they get any out of pocket, or they could go out of network. They will be removed. Those three buckets of money that they could use is not going to be there for them in 2025. So you do want to go over this with your client, because you don't want them to get there thinking they're going to use their spendable cards to pay for different, say, vision benefits on their eyeglasses. That's going to be removed. They are going to be limited to the regular benefit. The rest of it is going to stay for next year, and we've added one new improved. That is the home improvement and safety. So we do have that for next year. So that was included. And it is a benefit that is operated and offered by Solutran. So that is going to stay the same. Now, with the home improvement and safety, I just wanted to give you a feel for what that actually is. And that's going to be like non-slip floor coverings, grab rails. If they need, say, air quality equipment, they need something to purify the air, pest controls and sprays and different things. And then we've also added Amazon over-the-counter and healthy food fulfillment for next year. And the nice thing about that is Amazon has waived the $35 minimum shipping, so they can order as little as they want without worrying about the shipping costs. However, if they are going to use their benefit for Walmart orders, Walmart is still going to emphasize that $35 minimum order for free shipping. And then they can also take advantage of Uber Eats. It's not to get their Starbucks or their dinner to their house. It's for the OTC and healthy food. And then Mom's Meals is who we have for our meal program. And this is different than when they get out of the hospital or the rehab center. Let's just say that you have a single older gentleman. He really doesn't want to cook. He can use Mom's Meals, and they have very good meals, and use them sort of as his meal program. Like you can sign up for the meal programs and you get them like 4 or 5 times, even up to 7 times a week, so that he can just get that, pop it in the microwave, and he doesn't have to worry about cooking for himself. And that way he is definitely eating good, healthy, nutritious food. So if your clients want to do that, that's another option they have. And then this is just going over our spendable partners, letting you know that we have tons of retail partners, 66,000 to be exact. Now, a lot of them, 1 through 10, we already have. You're going to recognize those. I'm being told number 7, Albertsons, because I couldn't figure out who they were, that is Weiss Markets. Ahold, a lot of people don't know, it's Giant Eagle. And then Del Hayes, that is going to be Food Lion. And then for the new retailers, the only one that I'm familiar with is Sam's Club. Now, this is something that we offer across the United States. So these in the Pennsylvania areas where you actually do sell. But we have a ton of options for people to use their benefits with a spendable card. And this is just for agents coming on that they don't know who the actual vendor for these services are. So I thought it would be helpful to include this. So for hearing, we have Hearing Care Solutions. Fitness is Silver and Fit. The meals, that's going to be Mom's Meals. Hers is by VRI. And the vision is Premier Eye Care, and dental is DentaQuest. And I'm going to pause here for a moment. If you were trying to find an eye care participant or a dental participating provider, you want to actually go to Premier Eye Care and DentaQuest for the best information on the providers. Unfortunately, our Find a Provider sometimes has all the information there as far as all the providers in that area, but we are finding out, if I could speak, that it's lacking some. So I would definitely go to their websites. If in fact you're still having a problem, we recommend you call either Premier Eye Care or DentaQuest, and they will help you find somebody for your client to go to. And then for the acupuncture, that's American Specialty Health Network. We have the routine chiropractic, which is done at any of the providers. The transportation is Motive Care. And then we have that Twill. And then the Spendables card. Optum recently acquired Solutran, but I do think they're going to keep everything the same. It's just to let you know that you may see Optum or Solutran on the card. Now, diabetic testing supply is not something normally you're going to sell the plan on during AEP, but we decided to add this because usually January through March, we get all these calls saying, who is your supplier? So our preferred supplier is One Touch. And with that, they will get 1 meter per 365 days. And when I see it listed like that, I'm thinking it's a rolling 365. So what that means to you is if on January 10th of 2024, your client got the meter, then it's going to have to be January 11th on 2025 that they would be eligible to get a new meter. And then they do get 100 test strips per 25 days. And we know that not everybody in the world is going to jump for joy about the One Touch. So if they want a different provider, non-preferred manufacturers are covered. They just need to do a little bit more work, get with their doctor, do the prior authorization. And then if they would have a copay, depending upon what plan they're in, obviously DSNP would not, then it would be a preferred manufacturer copay. So we just wanted to give you the information up front. Hopefully it sticks, and that way you'll be able to answer your own questions when they start coming in the new year. And you guys are probably tired of hearing about the final rule and the 2025 Inflation Reduction Act, but we're going to just touch on a couple things. Is everybody good with the Medicare prescription payment plan, or do you want me to go through that at all? I'll touch on some high overviews. So at the very bottom, members can opt into this program beginning October 15th. They want to be proactive, not reactive, meaning they want to sign up for the plan prior to trying to use the plan or needing the plan. And this is one of the stipulations with the plan. If you sign up, all your meds are on. It's not just that you can pick and choose what meds are going to be on here. They're going to get a monthly bill for any of their medications. Once they sign on, it's going to be the total amount owed divided by the number of months left in the year. So with that being said, they can sign up October 15th of this year, which is coming up just a few days away, or they can actually sign up from January 1st on. With this program, there is no minimal threshold for the cost. So they cannot go and try and pay for a $3 med, but they want their $800 med put on the program. They cannot do that. And if they do not pay, when we do send out the invoices, and it's going to come from the carrier, or it could be coming from Express Scripts. So it could be coming from both of us, but if they do not pay that amount that they owe, they get a 60-day grace period, and then the member could be kicked off because of non-payment. And the member would also be ineligible for participation in the program in future years if they do have an overdue balance on the plan. And Express Scripts is still our pharmacy benefit manager. So this just goes into it a little bit more. And I wanted to mention that the member can also voluntarily opt out of the program if they would like to. And I don't know if you want to share this with the clients, but I wanted you to know that they are responsible for paying for any past due balances. If they voluntarily or involuntarily terminate from the program, there is no collection process. So it's not going to become medical debt, and it's not going to be turned over to collections. But I just wanted you to know that definitely they do owe the money. They have that 2-month grace period. But if they do not pay, then in 2026, if you have a member that wants to sign up for it and they're not being accepted and they're calling you, it's probably because they have an overdue balance they're not paying. and they're not going to give them $2,000 for free medication every year. So just keep that in mind as well. Now, this is the new enrollment rules for DSNP for next year. So if an Advantage plan has an MCO, a managed care organization that has taken on the Medicaid folks from Community Health Choices, then they are going to be able to enroll all year long because they're going to be aligned. And alignment means we have Pennsylvania Health and Wellness. If they want to get into the WellCare plan, we're both owned by Centene. We're a one card, one call. Claims are going to go through automatically. So we can enroll folks all year long. If they do not have that, then the beneficiaries will only be able to enroll AEP, OEP, or with a valid SEP. Now, dual eligible and LIS beneficiaries can disenroll from the Medicare Advantage coverage in favor to go back to Medicare, Medicaid, and pick up a PDP at any time. So that's different for next year. And if you have any questions, you don't understand that, definitely reach out. We can go over that. And it's very easy once you get it, but it is so many new rules coming at you this year. But this one's important to remember, and it actually gives us an advantage for 2025. This is just letting you know that Pennsylvania Health and Wellness is under our umbrella. We have a great relationship with them. It is allowing us to be an aligned plan. We are one of the 3 MCOs for 2024. We have a built-in membership based on Pennsylvania Health and Wellness, and like never before, partnering with Pennsylvania Health and Wellness has given us a real advantage. Part D, I don't know if anybody wants me to go over this, but I'm going to just in case you need to know it. It has been redesigned. We're all aware of that. They did formulary updates, and definitely the deductibles are now playing a part, and the max out of pocket has been updated. So you all know about the $2,000 max out of pocket. We went over the Medicare prescription payment plan. We know that insulin medications are capped at $35 a month. A lot of the vaccines are going to be at $0. These are going to be our 3 plans. The most effective one for the duals is going to be the classic. The premium is going to be applied to the LIS, so that is going to go down to $0. And everything here has a $590 RX deductible. It just depends on what tiers it applies to. Everybody's going to have the $2,000 out-of-pocket maximum. We did not change our network for this year. It's going to be the same: CVS, Walgreens, and the grocery stores. The one everybody pretty much likes is the middle one. That's the 0 premium. And you can see that it is going to have halfway down the screen, it says preferred retail tier 1. That is going to have a 0 copay. Then tier 2 is going to have a set copay. 3, 4, and 5 is going to be a percentages. Now on the Value Plus to the right, it does have a premium of $107.40. That is going to be a plan that has a bigger formulary. It is going to allow members to get their medication covered where a lot of the other plans do not. So it just depends what they're looking for, which plan would be right for them. Now, we do have some strategic alliances I want to go over. If anybody does focus on the veterans, WellCare is the official Medicare Advantage provider to the American Legion. So we do have a lot of posts in Pennsylvania. If that's something you're interested in, you can get assigned a post and you can go in and explain to them their options. You can be the one to help them all understand that they can get more benefits. It's not going to be that they're going to lose anything, but they have other options out there to go along with the coverage they currently have. So if that's something you're focusing on, please reach out and we can get you set up working with the American Legion. And then broker enhancements, just to go over our system so you know what we offer, and we have greatly enhanced them. If you want to upload your application, you can definitely do that on Workbench. Hopefully everybody is familiar with it. It is so easy to maneuver in there, and it's so easy to find everything now. The one thing I really like that is going to be important come January is the ID card feature. You can go in, your client needs to see a doctor January 6th. They don't have their card. Go in, print out a paper copy, send it to them. You save the day. They can go see the doctor. There's no stress involved anymore. They have all their new information. Now, there is also the PCP change. So as long as you're AOR or agent of record for that client, you can go in and change PCPs for them if that is in fact something they need to have happen. If you send in an application and it goes into an RFI status, that's request for information. There's only so many days you have to get that information in. Maybe it was something omitted or the MBI got transposed. That way, you know there's an issue. You can go in, you can get that information to the enrollment team, save that enrollment, and you can move on. Now, does everybody know what the deeming period is? If you have a D-SNP and they need to recertify, get their financial information and everything in there, the folks that are in D-SNPs somehow forget this, even though they need to do this regularly. Now you can actually notify them, let them know they need to do something, because that way they can get the information in. They won't be kicked off the plan, and you are going to save a lot of work for yourself because you don't have to go back out, re-enroll them once they do get the paperwork handed in. And then hopefully you have ordered information. If not, you definitely can. It is open now. And if you are someone that does not want the paper copies, then our PDF files, they're also ready to go. So you can just get the information that way too. And then this just lets you know that you must be certified and ready to sell for 2025 in order to be able to get the materials sent to you. Because some folks were trying to get the materials and they hadn't done the certification. So that's just a reminder there. And then I know you get a lot of emails, and AEP, you have a little bit of time to look at them. But if you see a broker update or a product pointer for us, it is worth your time to open it up. Broker updates are something definitely directly to you, and product pointers will let you know there may be some misinformation out there that we want to make sure that you understand exactly how a product works, such as the deal with Sunfire saying that our amounts don't roll over when truly they do. So definitely, if you have a spare moment and you see one of these emails coming in, please take the time to look at it. Now, this is a really good page for you to print out, have at your ready. Broker support, it gives you the phone number, the days of the week, and the hours. And yes, they are open weekends. The RFIs, the request for information, there's a phone number. It's the same as broker support. It's just press option 3. You can get all your information that you need to get to them, save your application that way. SPOP line is for Medicare, Medicaid eligibility. You can also do LIS there, and you can see they're going to be open 7 days a week, 8 to 8. You're probably going to work longer than that, but they're definitely there during those hours to support you. If for some reason you need to have a recording of a scope of appointment and you're somewhere where your systems aren't working, we have that option. You can call in. They will take the scope of appointment and they will actually record it for you. So it's on record. You don't have to worry about that. And if you're old school, we can still accept the paper applications. You can go into Workbench and you can submit it that way. Or if you actually want a fax number, there is a resource that you can go on with the brokers and you can, the broker resources, you can just go and it will tell you exactly the phone number. If you're having issues with that, just call Carrie or myself and we can definitely share with you that fax number. And this is just to remind you that our platform that we prefer is Ascend. You can do all your eligibility there. It also has Part A, Part B, start dates, when they use the SAP list, and Sunfire is there. It is a lot of agents' preferred platform for enrollments. Again, I'm going to caution you, some of our benefits might not be right. The providers, I can tell you they're not right. So definitely go to our WellCare, find a provider for that, and then it'll tell you again, SPOP, if you need to check those eligibility, the phone number and the days and times. And then this is just sort of a public service announcement. This year, we have had so many rule changes. It's tough to keep up with all of them. So just don't forget the rules that are already in place because there's so many new things to remember. You do need that scope. Don't forget about the 48-hour rule. Telephonic activities still need to be recorded. Always do provider verifications and check their medications. You definitely don't want a CTM. So do the best you can there to remember all of it. I know it's quite a lot of information you have to remember on each and every enrollment. And then do you have any questions for me?
Are you in South Carolina?
I am in Pennsylvania.
No, the program is the
We
WellCare.
Yep, we do have North Carolina and South Carolina covered with WellCare. The benefits are going to be different though.
Okay, so if I have a client that moves, signs up here in Pennsylvania and moves to South Carolina in the middle of the year,
Then
how?
you would need to sign them up for the South Carolina plan once they've moved.
Okay,
Yeah, and as long as you're licensed in South Carolina, you can do that.
okay,
And if you need contacts or anything for the regional agency managers there, I can definitely, we can send those over to you.
okay. So for like the veteran, the Patriot, what was the name of that
Yep.
one?
Patriot plan.
Okay. All right. I just wanted to know if that would be, if you would be able to transport that with him.
They probably have a similar plan there.
Mm-hmm.
Unfortunately, although we do have most of the United States covered, each state has a different set of benefits. Nothing is identical across the states. So anytime anybody would move into Pennsylvania or out of Pennsylvania, they would need to then enroll in that plan for that state.
Okay. And I would contact you to get that information.
Yep, you definitely can.
All right. Thank you.
If in fact it happens and I ask that you try and contact Carrie and myself because a lot of times we're out and about and doing events and things. So if one of us is not available, the other one will pick up the email and run with it or the text message. But if there's a case where you need something and we have not responded, broker services is so much better than it used to be. So they also can be a backup for you too.
Okay, thank you.
Mhm.
I have a question, Colleen. So the
Sure.
network for Pittsburgh and Philadelphia, how's the hospital network?
I'll start with the good news and go to the okay news. Philadelphia, we've got everybody. There is no problem with the hospital network. I'm also going to throw in that Central PA, we have pretty much, I would say 90%. The one I can point out that we do not have is Geising. We do not have them. That's going to be a tough one. And also St. Luke's, because St. Luke's is in the Lehigh Valley, but they're also owned by Geisinger. And we're hoping that maybe in 2025, we'll fill in that gap. Now, when you go out to Pittsburgh, we do not have AHN. We have every UPMC out there. So that is a workaround. If somebody is hard for and they want AHN, we are not the plan for them out in Pittsburgh, unfortunately. But if you get right out of Allegheny, it's very easy to work around that.
Okay. And what about and we have about 20 people on here, some people in the room. So far as leads go, how you guys can do with any overflow or extra leads that you guys may have, especially in the Philadelphia area. We also have some people on here from Pittsburgh too.
Okay. We can send them out through our Salesforce. I'm not sure how you guys want to set it up. If you want to have a main contact person and then they disperse them, or if you want us to get everyone their own Salesforce account. But I can tell you, if you accept the Salesforce leads, they need to be worked and dispositioned, meaning you need to go in and say what happened. You called them, they didn't respond. You enrolled them. You're going to do a callback. They're not interested, because if you accept the Salesforce lead and do not disposition, we get monitored on that heavily, and then you will get less and less and less leads if you're not backing us up. So we'll help you as long as you help us. So I don't know how you want to have that set up, and that can be a conversation we can have offline, but definitely we have leads that we can send out and have everybody work, but they do need to be dispositioned.
Okay. I can talk to Chris about it. I mean, I prefer them getting it on their own. Whoever wants to be very serious people who want to do that lead program, who are tech savvy and who can check their Salesforce on a daily basis. I think that's something for them. But we have enough people here who have a nice PA Health and Wellness book of business. So I know they're going to be doing some WellCare anyway. And also supplies too. I just got some supplies in, but it was only about 10 booklets. I know I need more for my office. Do people automatically get them, or how does that work? Can I get a big shipment, or how does that work for our supplies?
Well, everyone is going to be limited to 10 each. So if you have a whole bunch of agents and they want to get on to Workbench and go to Custom Point and order their own supplies, they will get about 10. I do caution you that the plan books are big and clunky. And what I mean by that is it's almost like reading the Medicare and You booklet. It gives you everything you need, but you got to read page per page. We do have these trifolds. It's benefit highlights. They are so much better. If you open it up, it's got everything you need. If you're making a call and you're not familiar with the program and you have one of those benefit highlight sheets beside you, you look like an expert, because you can just sit there and look benefit for benefit and it'll tell you. So I would focus on more of those unless you're going to go out and into the home, then you might want to have a plan book. If you let me know what quantities of what plan you'd like, we can help you with that. We are not limited to 10, but I can honestly tell you that apparently the word got out that we are going to be a hot plan this year because we have already depleted our original supply. So they're trying to publish more so that we can get in there and do some more. But I can definitely, take what you need, just send it to me and tell me like 10 D snips in Philly area, 20 in Central, like whatever you want. You don't have to know the plan number. As long as you tell me either Philly, Pittsburgh, or Central, I can figure it out and order them for you. But I'm not sure how much they're beefing up their supplies because I didn't expect it to be out by October 1st. So apparently a lot of people have ordered.
So from what I'm hearing, since I'm in Pittsburgh, this is CJ, how are you? It sounds like Philly has better plans than Pittsburgh.
The Philly and Pittsburgh are the exact same plan. Allegheny County is the one that is hit the hardest with the lack of AHN. Around Pittsburgh and outside of Allegheny, we have a lot of success, but Allegheny is a tough county because of the lack of AHN being in the network.
Okay.
Philly, definitely, that is our best area, the 5-county Philly area. We've got all the facilities in network. And just so you don't think we're sitting back being dumb and lazy, we talk and talk and talk to Allegheny. And for some reason, they just are not interested in getting on board with us.
Okay, thank you.
You're welcome.
Can you put your contact information back up again?
Oh, sure. Give me a second. Hopefully you won't go blind trying to read anything as I'm going back. Where the heck? I didn't realize it was that far back. There we go. And you will see that Carrie, by phone number, she is out towards the Pittsburgh area, and I myself am right below Harrisburg. So it depends on where you're located, but Carrie and I both cover the whole state, and we do back one another up. Like I said, today she's on the road traveling to an event. So that's why you're not hearing from her right now. Or normally we do these together.
I have another question. Can you talk about, or do you have any material of the importance of alignment? Because a lot of agents, I know this is new to a lot of agents, and they're not seeing the benefit. Me being in this for so long, I understand coordination of care from the hospitals and billing, and a lot of clients are getting bills in the mail. So there's a lot of miscommunications. A dual ends up paying something because the one healthcare plan sent it to the federal plan, and the other, sent it to a state plan, and there's no coordination of care. And what I want to know is I know that a lot of the leads that you guys have is probably PA health and wellness leads of people who have, Medicare, so we can align them. Can you go over a little bit about that and what that looks like, how that works, so agents can understand the importance of aligning?
Sure. With an alignment, that means that an MCO for CHC, and I'm sorry I'm saying all these acronyms, that is a Medicaid provider. So with Pennsylvania Health and Wellness being a Medicaid provider, being under the umbrella of Centene as WellCare, what happens, and it's basically alignment is set up for the member's experience. If they go to the doctor, then the bill goes to their Medicare Advantage. Something on that bill that we don't cover fully, with it being aligned, it automatically goes to Pennsylvania Health and Wellness. The client gets no notification doesn't know anything's going on. And then the Pennsylvania Health and Wellness portion or the Medicaid portion picks that up. The client will not get a bill, doesn't know what's going on behind the scenes. It's seamless. That's why I said one card, one call, everything just flows. If in fact, and I'll pick on Geisinger, if in fact they have Pennsylvania Health and Wellness and then they have Geisinger as their plan, that same scenario, they go to the doctors, the Geisinger plan would pay whatever it is supposed to. And if there's anything left over, because it's not aligned, then the client gets sent a bill from the provider because it doesn't automatically keep going. So then, and unfortunately, some clients pay that bill. What needs to happen is that client needs to be aware, intervene, contact the provider, tell the provider that they need to send the rejection from Geisinger along with the billing to Pennsylvania Health and Wellness. That doesn't happen. The client really shouldn't need to intervene like that. So that's where they get bills. The Medicaid provider never gets that. So the payment is just stuck out there, and sometimes it goes to collections, which is unfair. So by 2030, CMS wants everybody to be aligned so the members don't have to deal with that.
I have a question. Can
Go
you
ahead.
can you explain now when someone has Medicare, can you break down what actually goes on if they're Medicaid, Medicare, what breaks down on the Medicaid part? Let's say if they're with another plan, and this is just more for educational purpose, what part goes on the Medicaid part? Because I know I know the hospital goes one way and then the other services. So can you please break down what services goes on the Medicaid part, please?
Well, if they have an MA plan, anything that is covered by the MA plan normally just gets picked up and everything's okay. If they would somehow code it wrong, or it is a service that the Advantage plan will not cover, that's what goes over. I'm trying to think of anything specific that we would not cover that would go over to Medicaid. If there is something that costs more than
I
the
guess what
plan
I'm saying
allowance,
is that
or
I
here's a
found out last year,
okay.
I found out last year, for example, a lot of people, if they go in the hospital, then their home care would go on the Medicaid, and I'm just this is just to be able to explain it. Their DME goes on the Medicaid. I was just there. So I was just trying to figure out in that way, just a good way to kind of have the hospital goes one way, but they did pull some things off to go on the Medicaid. Is that correct?
That may be correct, and I apologize because I don't know all the services that
Okay.
possibly grow, and that's why I was racking my brain trying to think of an example when it happened. I can tell you that if you have someone that is interested in WellCare and they don't have Pennsylvania Health and Wellness, there is a phone number, an independent broker line that you can actually call and get them switched over to Pennsylvania Health and Wellness. The client has to be on the phone and say that you do it April 1st. Then May 1st, they would have Pennsylvania Health and Wellness, and then they would be able to be aligned. So that will give you the opportunity to enroll them. If in fact you do it the 16th or later in the month, it takes 2 months for them to get in. So if you find somebody that would be a prime candidate for WellCare and they don't have Pennsylvania Health and Wellness, they have UPMC, for example, you can then get them onto Pennsylvania Health and Wellness, and that would give you the opportunity to enroll them throughout the year. So that's another thing I forgot to mention. So there are ways to make them into an aligned situation so you can enroll them if they don't originally have Pennsylvania Health and Wellness. And I'm sorry, I couldn't come up with an exact example of what sometimes rolls over to the Medicaid that we do not. A lot of times, if the Medicare Advantage has like a service limit, then if the person goes over that service limit, say they have 12 in-home visits or whatever, and they actually have 13, 14, or 15, that would then roll over to the Medicaid portion. So it wouldn't become a bill for the client. But I'm trying to think of an exact example, and I apologize, I'm not coming up with any.
Do you have any material that says like anything like that, like the importance of aligning? I did find something on Google that the federal government kind of was talking to us agents, letting us know sort of the importance of aligning, you know, with the plans or the coordination of care. And I'm saying that because it's you got to kind of fight, you know, some of these clients, because now we're going to get them aligned and they're spoiled, you know, with spendable cards, you know, they have here in Pennsylvania, and they don't want to change. And they think that if they don't change, oh, you know, it's going to be okay. I'll just stick to my plan. I'm like, no, the important factor is really aligning more than anything. And I'm trying to drive it in agents' heads that, you know, aligning and coordination of care with their caregivers, their home health care, their hospitals, and co-pays that might slip through the cracks, the importance of aligning with their state MCO plan. Is there anything like that that you know, WellCare or PA Health and Wellness has out there, flyers, anything out there that just goes over highlights or anything?
Well, I can reach out to my contact there and see if they have something. I know they've done presentations, but it's never anything concise that it would make sense if, like, you just got their presentation. You'd still have to know a lot behind it before you'd understand what the presentation was. So let me reach out and see if they have a pamphlet or anything that would actually explain alignment. Now, the
Okay.
one thing I can say is that this year, I was just on our captive call and we went over a comparison of benefits. We are pretty darn competitive this year. And I'm just going to say it. Aetna usually is a thorn in our side. We're very, very, very competitive this year. And Aetna seemed to have backed off and backed down with their benefits. So that's one case where there are a ton of Aetna people, which now our plan is actually going to be more beneficial for them.
And
So,
also, that's exactly who we're targeting. Also, the dental for the D-SNP. You're saying like it's basically it has restrictions. What are the restrictions? Is it
okay.
I can't say unlimited, but you know, like what are you can get this, but you're restricted to this. What are those?
Well, we were just talking about that because when you say unlimited, everybody's like, yeah, whatever. But it actually is unlimited dollar amounts. What is limited is services. Like you can only get 2 implants a year. You can have 2 cleanings in a year. That's how it's limited. If they have 20 teeth, God forbid, I hope they don't, that need to get fillings or root canals or caps or crowns, there's no dollar limit. So whatever they can bear to go through in a year, they can get done. But there are some services, and it's just like those 2 preventative cleanings, and say the x-rays, they have a limit. And that's what I'm talking about, service limits. You can't go get x-rays every week because you just feel like getting them. And I don't know of anybody that would apply to, but you couldn't go get your cleanings every week. because that service limit, and that's according to CMS guidelines, is 2 per year. And with the dentures, it's going to be 1 set of dentures every 2 years. So that's what I mean by service limits. There aren't dollar limits for a
Right.
DSNP.
Okay.
It's just based on the services.
Colleen, I thought you said the D-SNPs would not be able to have implants.
No, the DSNP has implants in it. The
Okay.
partial DSNP plan does not. So that was one definite difference between the two. The full duals, absolutely. They have 2 per year. The partial plan, they do not have that benefit on there.
Any other questions anybody has? I mean, this is good stuff. I mean, as far as the dental goes and the spendables and the rollover, that is awesome because you can use it for the gas at the pump. There's a lot of restrictions going on now with the other competitors next year for their, I would say, comparable spendable cards, where they're limited now, where you guys are more open to other services, which is awesome. So that's why we're asking these questions, because I know a lot of agents are going to have questions on how to spend it, because the point that I'm making is that a lot of agents are going to have to really sell now the concept of aligning now, because a lot of people are comfortable. Well, it's not going to change so much. Like, yes, it is. The benefits of your cards are going to be limited or restricted. Your dental is shot down. This is shot down. So, what would you say to that? How would you approach someone, with a competitor and they have PA Health and Wellness as their MCO? What was your insights would be coming from you? I know for ourselves, how I would pitch it, but how would you swing it?
Well, if they have Pennsylvania Health and Wellness and they have a different plan, I would ask them if they've ever been sent a bill and go from there and say, did you like having to deal with that? Because with WellCare, you won't get a bill. It'll automatically flow through the system. You won't have to worry about that. We are so competitive this year. And I guess it's good that I just got off of a call where we were comparing all the plans. There are some plans that are that have higher, like spendable amounts. However, there are very few that have rollover. The other way you can approach it is, do you like to have to spend and remember to use that amount of money every year? I mean, every month, sorry, because ours lasts for the whole year. It'll roll over and you can use it on whatever you'd like. There, I think, were 2 or 3 other plans at the most that had money that rolls over. The ones that have the higher amounts don't roll. So it's use it or lose it. So they say 300, but you don't really get 300 because you have to figure out how you're going to use it every month. And God forbid you don't, because then that money disappeared. With ours, if you want to save it up to pay your rent, you can. If you want to pay all your utilities, you can do that. And if they're higher dollar amounts, you can just roll it over. Nobody wants to buy $500 worth of Band-Aids in a year. So that's another thing. And we're pretty darn competitive on dental, on vision. I know hearing really isn't like a big deal, but we're definitely competitive there. This year with the alignment, we have a really good opportunity, maybe not to be number 1 in the market, but we're definitely in the top 3. The other thing I would say is we have a lot of the benefits, like transportation, 61-way trips. We were looking at that. If that's something your client needs and you do a comparison with the other programs, I think there was maybe 1, 2 at the most that had more trips. and you really want to take a look, if you're going to go head to head with Aetna, I think they dropped to 24. So basically they say 24, but that's only 12 rides. That's one a month. So we have 60. That's going to be a big plus.
Excuse me, I hear you said you guys did a comparison. Are you, or can you throw a quick comparison sheet together? I mean, that would be really helpful. Like, in other words, you guys have done the comparison, I think our biggest comparison down in this area will definitely be Edna. So if we kind of had like a comparison sheet, that would be really great, because then you go, side by side and you could just see it.
Yeah, I can see if we can do that. The way it was actually one of our captive agents. Thank God, amen for him, because he put it all together and it was a ton of work. I can see if I can send it, because he did all the work and I don't want to send out his sheet without his approval, but it goes over all the DSNP in the state. It's a little, he focuses on Philly. So Philly is the primary, it's the benefit that appears first, but then he tells you about the other ones. So I can possibly get that out. If you'd like just WellCare versus Aetna, that would be an easier fix. I can definitely do that too.
I think for me, it would be, I don't know with everybody else on the phone, but comparing it to Edna, since they were giving the kitchen sink away, that would really be great. I mean, because then, you can tell them, and they're going to switch because they do want to keep those to be able to roll over and, still kind of keep those same benefits.
Yeah, because those members are going to be shocked. It is drastically changing for next year. They are not giving away much of anything. As a matter of fact, they're taking away pretty much everything but the kitchen sink. So yeah, that's the first I've ever seen them pull back benefits, and they pulled back hard. So yeah, I can see if we can get that together. And would I send it to you, William, or how did we want to disperse it?
I think it'd be better if it goes to Bill.
Okay, sorry.
Yeah, no,
I
it's
didn't
fine.
know whether you went by William or Bill. So
Oh yeah, but I prefer the Aetna. Any type of comparison with Aetna would be great, because that's
okay.
pretty much what everyone has. So it's on the hit list.
Yep, we can definitely do that, because that seems to be on everybody's hit list
Yeah,
here.
so they want it
Yeah.
anyway. Well, we're doing them a favor. It's too much utilization, so they prefer it.
Oh, I know. They definitely want to move some of their book somewhere else. So yeah, okay. We can definitely do that. I am on the road tomorrow. I think Carrie is, I don't want to misspeak, but I think Carrie is around tomorrow. So we will try and see if we can get that out by Friday. Definitely we will get that to you before the 15th. Because boy, that is only like 6 days away. We are running out of time. But we'll definitely get that to you, because I'd like to put it in a little more concise of a spreadsheet than what we have, because it was a little noisy if you're not up with each plan. So yeah, it'd be easier to read if we would redo it rather than use what he had come up with. But definitely all the information is there. We would just copy and paste and we'd be good to go. And it's amazing at the different numbers. And I think there's one place they beat us, but I think it's only one benefit. So we shall see.
Oh, last thing. Do you have our members getting anything like for healthy, seeing the doctors or anything like that? Are they getting any rewards or anything?
Yes, they do get rewards. That's sort of down in the weeds, but yeah, they do get the rewards. They get the gift cards for getting like a flu shot and I don't know if they're still doing it with COVID shots, but like all the regular checkups, the WellCare visits, all of that.
That's awesome. You know, hopefully we can show clients that as well. But other than that, I'm also I'm great. We just got some kits in the office and agents are grabbing them. So I'm just hoping that everyone on this Zoom has gotten their contracts. If not, please send me a text or email and I can send them to you right away, guys. We can send it over to Chris Holmes. He just left. He had another meeting he had to jump to, so we could get you guys contracted with WellCare. I know contracts have been going over. People have been onboarding right now, Colleen. So we have people jumping on, and it looks like we're going to have a big year with you guys too as well, especially here in Philadelphia, because half of the people, you know, here have PA Health and Wellness.
Yeah, it is big out there, and that sometimes is what to lead with. Pennsylvania Health and Wellness is well known in Pennsylvania. WellCare, they're familiar, but PA Health and Wellness is well known and very trusted. So definitely that's a good thing to mention.
Awesome. Well, I appreciate it. I don't know if anyone else has any other questions, anything else?
I do. On your partial D SNPs, they look like some of them have premiums. How's that affected with the LIS? Do they actually pay part of those premiums, or are most of
Yeah.
those covered?
Yeah, no, it is going to be affected due to the LIS. So that would be then decreased. I still think they're going to have a little bit of a premium. I don't know if anyone has seen it because I've been looking for it. I did not see that they've released the LIS figure for 2025 as far as what they can take off of premiums. Did anybody see that? Because I've been looking and I haven't seen it. Okay. So as soon as CMS releases that, because there's a lot of things that for some reason this year they're holding on to, and hopefully they don't hold on to it any longer than the 15th, because that's going to sort of cripple some of us from being able to tell exact figures. But yeah, it will reduce it by whatever that amount is. So it's probably going to knock it at least in half. Is there anything else, guys? I don't want to hold you up because I know it's a busy time of year.
Oh no, I think this was great. I mean, everyone here in the office, we're watching it. We're going through the kits and the brochures. We see them now. Let me see that brochures, Steve. These are the brochures you're talking about, the benefit highlights.
Yes, those are gold, because
Okay.
even if you want to either mail one out to a client or show it to a client, that is one page. You don't have to go from page 20 to 22 to 30 to, yeah, to try and tell them benefits. And then you look like a fool because you don't know exactly what page it's on. There, that makes you look like an expert, and it is so easy to understand.
I mean, the one on the left is for who and one on the right. So they mirror each other, but they're not for the same.
The one on the right is for Philadelphia. Yep. So no, I appreciate it. Guys, we got anything else? That's it.
Yeah, see those.
So I guess Chris emailed Nicole so we can set something back up for a training for agents who want to participate in Salesforce. It looks like we was chatting with Chris, and we prefer the agents get their own Salesforce and be trained on it, and get out
Okay.
there and be responsible for it. So just a FYI. I know he had to leave, but it's we wanted to set something back up for training for that. For agents who are
Okay.
contracted already.
Okay. Because yeah, I have that as a follow-up. We need to have names and emails so that we can get everything set up there. I'll get the Aetna versus WellCare comparison out to you. I'm gonna reach out and see if I can get the Pennsylvania Health and Wellness Alignment, like a pamphlet or a decent, concise, easy to understand information on that. So we'll see what we can do with that. And then definitely if you have any need on supplies, I'll do my best. Usually if they totally run out again, they will let me go to a local printer and get things printed up. So that might be an option too. I just have to check with Nicole to see what they're going to do this year if we run out, because this year it seems like they didn't anticipate us being quite the hot commodity we are, and things are running tight already.
Is it too much to ask to add Cigna in that?
Nope, I got Cigna too. So you want us
Alright.
to do Aetna, WellCare, Cigna?
Yes, please. Thank you.
Okay, is there any other companies?
No, I can't think of any. I don't know about anyone
Okay.
else.
Devoted
Good, I
wouldn't
love
even,
that.
yeah, that's it, because Devoted is just, they don't have no network. That's it.
Yeah, they're too new and they have great benefits, but trying to find a provider to make it all happen and fit is going to be tough with them.
What about independence?
Yep, I think, I'm sure we didn't mention it too much because I don't know that they're going to be, trying to think. I know there's Jefferson. I'm trying to go off of what we just went, but I can see, and we can do Independence too. I'm pretty sure it was on there. Because he definitely focuses on Philly and they would be a player down there. We can do it.
All right, Colleen, thanks so much. And thanks so much, guys. I appreciate it so much. I know we'll be, you got a question? Go ahead. Do you guys have any loose applications, just like PDFs of just the application?
It's after the 4th, so I'm sure that the PDFs are out there of the application.
Yeah.
If you want me to, I can pull it and send you the PDF. And is it just the D-SNPs that you guys want?
Yeah, just the D-SNP,
Okay.
the Philadelphia one.
So,
Yep.
Yeah, I think the app's going to be for all of them. You just have to check 002 or 007. And again,
Oh.
remember that 002 is for Philly and Pittsburgh. That's the easiest way. And that's the one that has a 192 spendable card. So it was nice that they aligned that with 2, 2, and 2. So it's easy to remember. Okay. Well, thanks everybody.
Thanks so much,
And
Colleen. Yep.
I look forward to a great partnership.
Absolutely. Yep. We'll
Thank
be
you.
in touch.
You're welcome.
Everybody says
Thank
bye
you.
in here.
Yes, bye-bye.
See ya. Thanks.
Welcome.